Anybody, good afternoon. I'm doing very well, thank you. Please come. Yes. Video consultation. Yes, we need to do. I think we had told you byjaw surgery or something. Can you see your ears? Yeah, that's it. Yeah. Smile. So, you have taken scan also, right?
Yes.
And we have also told you will need a byjaw surgery.
Yes.
So we will need that byjaw surgery. Where because your this has come forward, gum is visible, chin is inside, lot of issues. Everything we can correct in one surgery. And you will have to stay for 1 week after surgery. Total recovery is 3 weeks, maybe 4 weeks. 1 week there will be a lot of diet, liquid food, semi-solid food. To eat normal food, it might take 2 weeks, sometimes 20 days. Some patients we also advise braces, aligners, some orthodontic treatment. You might mostly not need it, but in case you need, we will let you know.
So is it like braces percentage? You mean to say? Is it like
Braces you will not need, I'm saying. I'm saying you will not need braces mostly.
mostly?
99%.
We can cover in this.
Yeah, we will finish everything for you.
And you'll be fixing plates and
Yes.
screws, right?
Yes.
So that will be removed later.
No
on.
need.
It's permanent.
Permanent. If you want, we can remove it after 6 months, but there's no need for you to remove it. It just stays
So will
there.
it cause any
No,
uncomfort?
nothing it will cause for you. You will be fine. You will not know plates and screws are there. They're very small. They're very strong, but they're very small. So you will not feel, you will not know anything.
And if there are any side effects if I go for a surgery, so will I have
For this
any
surgery?
Yeah.
So see, not side effects, but every major surgery, some bleeding, infection, risks are there, right? That's why we make you stay here for 1 week to make sure there's no complication. Then we can do.
That numbness and all after the
So numbness will be there. Some patients numbness is there for 1 or 2 weeks. Some patients 1 or 2 months. But after 3 or 4 months, no numbness. Sure, that is guaranteed. But initial numbness, usually most patients will have.
So if we have this screws and plate in our mouth, so can we have the solid food and
Yes.
like after how many?
I told maybe what 1 week.
After 1 week we can have solid food.
Yes.
I mean to say hard food like
Hard food
chicky
3
and
weeks. No, 3 weeks, 1 month.
1 month. Then later on we can.
After 1 month, you can have all the food you are eating right now. No restriction.
And we don't have any kind of side with respect to vision and all.
Nothing.
Nothing right. Yeah.
No,
Because
don't worry. Nothing will happen to vision and things like that. You're doing a lot of research. They will write all these things, side effect, contraindications. No.
So is it like I have more gums. So if I smile, you can
Is
see
it corrected?
the gums. That will also be corrected.
Everything, yes. Gummy smile will be corrected, incompetent lips will be corrected, retruded chin will be corrected, short lower jaw will be corrected. We are saying byjaw surgery, it's an umbrella of term that involves all the procedures on both the jaws. That's all. But in your case, we'll correct everything. You will not need any procedure after. There will be a huge improvement in your before and after.
So that I can understand.
Hmm.
But I just want to show you this thing. I got this picture. So she looks little similar to me.
Correct.
I mean,
Yours is a little bit more
More.
severe case than hers.
hers.
Because if you look the before here,
Yeah.
she's able to at least close the lip
Close.
and that
But
is
I have little gap.
correct.
Yeah.
So it's similar like this.
So then
Yes.
later on, can I have this
You'll get better than this.
better than this?
Yeah.
And like after having the
And
surgery,
if you see carefully, so in the before here, you see she's having less gummy smile.
yes.
When you smile, the gum is really exposed. So, for example, a vertical maxillary excess, yours is a little bit more than when you compare with this girl. So, because of that, what happens? The change before and after will be more. more dramatic change will be there, like more wow results, because the before is more severe.
And sir, if I have the surgery, so to speak it was a little difficult.
No, you can talk straight away first day itself.
First days.
Yeah.
So after the 8 days, then I can able
Oh
to
yeah,
speak.
yeah. 8 days you can speak. In up to 2 to 3 days quite well. See, there will be some pain when you try to speak, maybe, or some difficulty in opening the jaws and all of that, but it should not be preventing you from speaking. You can speak.
And this results will be permanent.
Yes, for life.
If at all, I would like to have the surgery later and after this week.
Okay, whenever you want.
Okay.
You can tell us a date so we can plan accordingly. Or better is, you come one day before you want the surgery. That is the best thing, because then we'll take measurements, we'll do blood tests, we'll have to do a lot of work here in the back end. So when you decide, let's say 1 week or 1 month, whenever it is, one day before you show up, take appointment. Then after that, 1 week, you have to stay after surgery. By the time everything will be done. You can do that then. You can ask them now itself when you want the surgery. Book the appointment next week or you said, whenever you want, you tell them. Then accordingly come, we can plan. Any other doubts you have? And by the way, no scars will be there. Everything will be done from inside the mouth. It's probably going to take us about 3 to 4 hours.
So if at all I want to remove the plates,
You can remove after 6 months or after 4 months. I remove it in a 1 day procedure.
Okay.
We'll come today morning, remove both that day night or next day. It's a very small procedure compared to the placing.
By that time, everything will be.
Yes, it will heal in 2-3 months. We are removing some plates also out of some patients who are very concerned, doctors, surgeons, people like that. So if you want, we can remove it. We do not recommend it. It is not needed, but it's a foreign material anyways. And if the role of the foreign material is over, it's good logic for you to get it removed. That's the first thing. Secondly, some of the patients will consider some other surgeries. Oh, okay, I'm now looking so good, now do rhinoplasty. Example I'm telling you. So then in that surgery, we remove these plates. So it's a, or suppose you have some other procedure in some other hospital, that time we can combine it with another thing so that it's not a surgery just for plates and screws. Now in your case, we might get anywhere from 6 to 8 plates and from 20 to 34 screws. So the number of implants are higher. So you could choose to get it removed. But a lot of the patients after a few months are very comfortable. They don't think of a surgery. Get used to it. You'll not do anything. If you still want to remove, you're there to remove it. It's not such a big procedure.
So the plate material is
Titanium. That's it.
Yeah, because I used to have lots of hard food like chicky and all. So
You can have after a month.
So I was worried for that because we are getting fixed plate inside our mouth. And
But you can eat. In your case, we can eat. There are some patients, when we do different complex jaw surgeries, we will ask them to wait for longer periods of time. You should be able to eat without a problem. Wait for a month after normal food, anything you can eat. Okay? Alright. Inko bhi rujo.
Thank you, sir.
You're most welcome. You don't have any medical issues and all, right?
No, sir, I don't.
Okay, very good. Alright.
Thank you.
You're welcome.